comments saying, hey guys, Bill here over in Sebring, feeling great since you repaired my L4 and L5 discs. No leg weakness anymore.
Bill, great to hear from you in Sebring. Yeah, I remember. We did your surgery a few weeks ago. It's so nice to hear from our patients. You know, for this last 2 weeks, we've been hearing on our live stream from our patients, and I'm so happy you guys are out there sharing your successful treatments. We need it right now, folks. We really need it. Thank you so much, and I'm glad you're doing great. Hopefully, you're back to having a normal life soon. I know you got some restrictions, but follow your restrictions, let your back heal, and we'll hopefully not have to ever treat you again. All right, we're just about done with this disc. Remember, this patient is wheelchair bound. He's been living in a wheelchair for years, and his quality of life has been horrible because of his disease that he deals with, his multiple sclerosis. But his sister actually came out to take care of him after surgery here. I met her. She's a lovely person. And I'm so excited because we confirmed that these 2 discs that I'm fixing, and again on the MRI you can see they don't look that bad. Most doctors wouldn't treat them. They would say that your discs are not causing any problems. But actually these discs are causing his problem. And it's our many years of experience treating back pain that gave it away. Honestly, without my 29 years of neurosurgical experience, I never would have known these discs were the cause of his problem. But I knew when I saw him and I saw his MRI and where he was pointing, where his pain was, I knew it had to be these 2 discs. And I was right. So if your doctors can't figure out where your pain's coming from, come to Duke Spine. We'll do a free evaluation and we'll tell you exactly where your pain's coming from. More importantly, we'll tell you how we can fix it for you. Just about done with this disc. You can see the last of the tear. Any other questions or comments?
At this moment, no current questions.
All right, let's get back to the SI joint since Donna asked us about it. The sacroiliac joint, I was telling you guys, once it's damaged and it's painful, that pain never goes away. And the only treatment that's really been promoted in the last 20 years is fusion of the joint. But it turns out that fusion of the joint doesn't work. I knew that. We tried a few of them, and patients were never happy with the results. They continue to have SI pain. We saw a lot of patients coming into Duke Spine with SI joint pain that had fusions done. Fusions just don't work. They did a study out of Norway that showed sacroiliac joint fusion doesn't work. The patients have the same amount of pain before surgery and after surgery with the fusion. So we knew we had to do something different. Shots don't really work, pills don't work, therapy doesn't work. So what works? Well, there's one thing that works. It's called rhizotomy. And that's where we go in and kill the pain nerves, destroy the pain nerves permanently. Now, if you have a rhizotomy done with radio frequency, it's called an RFA rhizotomy. Those procedures don't work, unfortunately. We've tried them for years. They give you some temporary relief, but the pain always comes back. So we had to create a new type of rhizotomy, one that would work and it would last. And that's why we brought in the Duke plasma rhizotomy as a treatment. We've been doing it now for about 3.5 years, 4 years now. And our patients that we've treated with the Duke plasma rhizotomy have 100% sacroiliac joint pain. We've had 0 failures. Everybody's been very happy with the results. And more importantly, we've had 0 complications. So it's not only effective at eliminating sacroiliac joint pain, but it's safe because there's no complications. All right, we just need 10 minutes more, Dr. Berndes, and we'll be done, okay? How's our patient doing from an anesthesia? Good. Any questions or comments?
At this moment, no current questions.
All right, we're going to enter with the dilator shot. We're going to go down to the L5-S1 disc, and we're going to treat this disc the same way we did the L4-5. Now, L5-S1, we just confirmed it. It is also painful, right? It's a 10 out of 10 pain. And you can see the tear in the back. Jordan, show the audience the tear in the back. That's right. There's the tear. There's the leakage behind it. Yep. By the way, are we still on generator or are we on normal power? Should be back on the city power or the power grid, right? Anybody we need an answer?
No, on my end, all the lights are on, everything's working, so I believe.
So it was just a brownout.
Yeah.
For about a few seconds.
I believe so, yeah.
All right, so we back up.
Yep.
Well, we don't have any more surgery today, so otherwise we probably, if we're on generator, we'd have to cancel. We can't start any more surgeries when you're on generator power. But we're back on normal power. That's the thing about living in Florida, folks. We get a lot of storms this time of year. You know, July, August. There's a bad one? I didn't even know. You know? I check the weather every day because of my garden, but I just saw rain. Let's see this. Shot? All right, that's good. Yeah, I see it now. All right. So just wind? Well, somewhere a tree must have gone down and took out a transformer or something. All right, folks, this is our last disc and our last surgery for today. That's a lot of scar tissue. Laser. Now, we're going to be done. It's Tuesday. We're going to come back Thursday. We've got more surgery Thursday. Hopefully, God willing, there won't be a tropical storm keeping us from fixing our Thursday patients. Yeah. But this is it. We got about 10 minutes left, so if you have questions, please ask me. Otherwise, I'll just operate and you guys can watch. That laser fiber you're seeing right there, by the way, it's a beautiful tube. Look at that tube. That's a stainless steel, German-made endoscopic sheath or tubular retractor. That's a brand new one, I think, because it's got no blast marks from the laser. This laser can melt steel, even stainless steel, German stainless steel. And it does. And if we have an older tube, you'll see some little marks along the metal, right where the laser hits it, and it'll melt it. So you can see melt marks. This tube is brand new, that's why, and I just asked Louis, he confirmed that. This is a new tube. These tubes are expensive. They're about $600 a piece. They're very expensive tubes. Don't ask me why, but I guess it's just expensive. Unfortunately, when you start adding up all the costs, it gets expensive to do spine surgery. Now, laser surgery, we try to keep this as inexpensive as we can for our patients so they can afford it. A lot of insurances won't cover laser surgery. Not yet, but they will eventually. Sometimes it takes some fighting in court to get them to cover it. I hope this patient's insurance covers his surgery because he needs every dollar for his medical care and life. He's got a difficult life being in a wheelchair all the time. All right, any questions or comments?
No current questions, so we do have a comment coming from Donna once more on Facebook.
Sure.
Saying, thank you for all that you do, Dr. Duke.
Donna, you are most welcome. I do what I do for the people that appreciate what I do. I don't do it for all the haters out there. There will always be haters. You know, it's funny. Henry and I, after we were just commenting on some of the stuff going on out there in the social media world, but it reminds me of a song by a band called Depeche Mode back in the 80s. How many of you all remember Depeche Mode? They had a song called People Are People. And in the song he talks about why do people hate him? You know? He's done nothing wrong. Just listen to the lyrics. And it's amazing how hatred is so common, even back in the 80s, when the 80s were such a great era. You know, people just don't like other people for some reason. There are just haters out there. And with the haters, there's nothing you can do to make them happy. So let them hate. Even Taylor Swift talks about haters. Haters are going to hate, right? Was that Taylor Swift?
No, it was. You're correct.
Yeah. Yeah, so it's funny how a lot of bands and very famous singers, performers, they all talk about the haters in their songs. From Depeche Mode to Taylor Swift. Even Armenia. My last patient, folks, she's a historian, and she was talking to me about the Armenian genocide. She knows that I'm Armenian, and how the Turks massacred 1.5 million Armenians back in 1915 to 1918 because they hated the Armenians. Armenians are very successful, very good farmers. They took good care of the land. They were very good at farming and agriculture, making food, delicious food and wine and cognac. And they were living next to Turkey, which was a Muslim country, Armenia being Christian. And a lot of people don't know that the Turks came to Armenia and slaughtered 1.5 million Armenians in a genocide that the Turks have never, ever acknowledged. Now, I don't hold resentments towards the people of Turkey right now. I've come to terms with the history. It's happened over 100 years ago, and I hope to God it never happens again. I'm against any kind of violence in the world. That said, it just shows you that hatred is something that is real, and that I'm hoping someday we won't see this kind of hatred in the world, that people will just respect each other and their differences and try to get along.
We have a question
Yes.
coming from Smallville, once more on YouTube.
Yes, Smallville.
Asking, by the way, Doc, do you know Dr. Cole Kim? He also does laser spine surgery, but it's different from yours. It's amazing what you guys do.
Oh, thank you, Smallville. Yes, I know Dr. Chol Kim very well. He's Korean. I have his phone number on my cell. I call him from time to time. Dr. Chol Kim is in California. A really good guy, I think. I don't know him that well, but from my time that I've spent with him, I've known him for about almost 20 years now. And he's an orthopedic surgeon, not a neurosurgeon. So we are different. I'm a neurosurgeon, he's an orthopedic. But he does endoscopic surgery. And he was trained by Dr. Anthony Young. 5 minutes, 5 minutes. Dr. Anthony Young was just my beloved teacher. I have tremendous respect for Dr. Young, one of the greatest people on earth. He taught me and many other doctors, surgeons, how to do endoscopic surgery. And Dr. Chol Kim was there with me, learning from Dr. Young. That's how I first met him. Dr. Young is Chinese. Dr. Chol Kim is Korean. I actually married a Korean, so my wife is Korean. But Dr. Chol Kim is a good guy. He doesn't do the same surgery I do. He does similar. But he does very similar. He may be doing what I do now. He pays attention to my results. He always follows me and comments. So he may be using the laser more to debride the annular tear. If he is, then he's going to be getting really good results. But yes, I know Dr. Kim very well.
We have another question
Sure.
coming from Sherry on LinkedIn.
But before we take the question, I want you guys to look carefully here. You see the blue? That blue is the dye staining the herniation. The herniation is coming from the center of the disc out through this tear. And the tear is in the white stuff on both sides. It's the annulus that's torn. And the herniation is stuck inside the tear. And we call it an interposed herniation. It's stuck between the sides of the tear. Right here, that's what I'm removing with the laser. And by doing this, we're getting rid of the source of inflammation and the source of herniation. By cleaning this tear, we're allowing the disc to reseal itself. It's going to close off on its own. And I know this looks really big to you guys, but it's actually very small. Just for size reference, you guys see the fiber right there, the laser fiber?
Yes, we do.
That's 1 millimeter, 1 millimeter. So if you think about it, everything you're seeing inside this tube from side to side is about 5.5 millimeters or 5 millimeters, all right? So even though this looks like a big old tear, it's only 5 millimeters. And by the time I'm done, you're gonna see when I take the tube out, the tear will be about 3 millimeters wide. So your body can heal that very quickly if you had good blood supply. The problem is that the disc does not have good blood supply. The disc has very bad blood supply. The blood supply to the disc is almost zero. You guys see all the white? White means no blood. So all this material here is avascular. It doesn't have a blood supply. So it's very important to get it to heal properly that I clean out all the scar tissue, calcium, herniation, the kind of things that are keeping the disc from healing. That's what I'm doing right now using the laser. There is no other tool the surgeon can use to do this. You can use a bipolar probe, and Dr. Chol Kim actually uses the bipolar probe called the L4-L5 probe. At least he used to. Maybe he doesn't anymore. But that's what Dr. Young used to use, was a bipolar probe. It just doesn't work as good as the laser. The laser is far better, but the laser is far more expensive. It costs a lot more money than a bipolar probe. So that's why a lot of surgeons don't use it, because it's very expensive. But I use it because it's the very best at fixing the problem. And I want my patients to have the very best results that a human being can have. We're done, basically. I just need 1 minute. 1 minute. I'll take the comment question.
Coming from Sherry on LinkedIn, asking, I have a question. Are you not on Facebook anymore?
Oh, no, we're on Facebook. We're on Facebook.
Yeah, we're streaming.
Yeah,
I
believe we're streaming on Facebook.
Yep.
We're still on Facebook.
Yep.
There's just a lot of nasty people on Facebook who don't appreciate what we do to help patients. And really, we're here for patients. We're not here for popularity, okay? I am not looking to be popular as a surgeon. My goal is to cure back and neck pain. And that's what we do. We cure back and neck pain. Nobody else can do that. So that's what we want to be known for. And that's what we're trying to get the word out. So that's why we created our staged viral video that happened a few weeks ago. And it worked, but unfortunately, it didn't work exactly the way we were hoping it would. But yes, we're still on Facebook, and we will be for a long time. All right, 10 seconds, and we'll be done. If you have any more questions, this would be the time to ask, because we're pretty much done here. Look at that tear, guys. So that's about 3 millimeters. Remember that this laser fiber is 1 millimeter. Okay, we're done. That thing's going to heal up nicely. And I bet you anything, his pain is gone. His back pain is gone. So tomorrow, I'm going to do a testimonial with him. You'll see him and meet him, as long as he's willing to do it. And you just look for his testimonial in a couple of weeks. we're so behind on videos because we've filmed so many testimonials, we've filmed podcasts,
Yeah.
we've done so much, and we only have one guy editing. And Henry, he's like Leonardo da Vinci, you know? He's a master, and he won't release his work unless it's perfect. And I agree. I think that's the right thing to do. But his work of art is like that of a master painter, and it requires time and attention to detail. So that's why it takes us time to get these videos out, unfortunately. So we have a lot of testimonials. This patient hopefully will give us one tomorrow. He lost just very little blood, and he's going to go home with his sister today in about an hour. All right? That's the beauty of this laser procedure. The back pain will be gone. It's all done with a 1/4-inch incision, almost no bleeding. And he won't take any pain meds tonight, maybe just Tylenol. All right? So thanks for joining us. Any other questions?
No current questions.
Why don't we show the audience one of our newer testimonials you just released yesterday if you have it available.
Yeah, I can put it up.
Thanks, Henry.
Of course.
I'm Dr. Duke Machen, CEO and founder of the Duke Spine Institute. I have a patient with me who just had the Duke laser disc repair less than 24 hours ago, about 12 hours ago. And here you are. How do you feel today?
I feel better than I have in probably half a year, I'd say close to 5 or 6 months. It's one day after and time will tell, but I didn't think this was possible this quickly.
Yeah, time will tell. We've done now 2,200 of these surgeries with the laser endoscopic. Consistently, the pain is gone. It's permanently gone. It never comes back. And so I'm excited for you that you're gonna do fantastic. Now, you live about an hour away. How did you find out about Duke Spine Institute?
I got a referral and noticed that it was only an hour away, so made my way up here, and the first time I came for a visit was kind of felt like home, kind of felt like where I should be anyway, so that kind of fit right into everything this far. So
You had, was it back and leg pain, correct?
back pain a little bit, but my biggest issue was shooting down the leg pain. It was numb all the time for about 4 or 5 months on and off, so didn't know what else to do, and this was the right choice, I would say.
You came to us and we found weakness also. You had weak pulling your toe up. That's because the nerve was pinched so bad at L5-S1. You can see here on the video, we went in with a tiny Band-Aid incision, 1/4-inch. We went in and basically removed most of the herniation, cleaned up the tear where it came out of so that the tear will now heal. Your disc will heal naturally. And we did it all without removing bones or ligaments. If you had had a microdiscectomy or laminectomy, which is what every other surgeon offers, because they don't know how to do the endoscopic surgery, it's a newer technology, then you would have had a bigger incision, you'd be in a lot more pain today, and you'd have bone and ligaments taken out of your back. It would weaken your spine, which would set you up for fusion. But with our surgery, there is no need for any future treatment on the disc. It's permanently fixed. Now, are you taking any pain meds today?
I haven't yet today, and I haven't felt the need to, which was another surprise I had too.
Yeah,
So
no pain meds, right?
Nothing.
No bleeding, no hospital, no pain meds.
Nope, in and out pretty quick. It worked out pretty well.
Pretty happy?
I am.
And you were referred through Coral, right?
Correct,
Coral
correct.
Network.
Coral Network,
What
yep.
do you have to say to the Coral people who approved your surgery?
I just appreciate the approval and the opportunity to live like normal and be a normal human again.
Yeah, Coral did you well. I guess they somehow got you to us, and you avoided having an invasive surgery that was going to hurt you more than help you.
Correct.
Congratulations.
Yeah, well, thank you, Doc.
Anything else you want to say to your fans out there in YouTube land?
I would just encourage you to look into Duke Spinal and figure it out if that's the right fit for you, and it was for me, absolutely. So, thank you.
You're welcome, my friend.
Appreciate it.
Congratulations.
Take
Take care.
care. You too.